Hey guys, welcome back to another video. So first of all, I just want to apologise for the lack of weekly uploads. I've come to a point where it's very hard to find new ideas of what to record, and I promise I am coming up with more, but at the moment I'm trying so hard to brainstorm new ideas. So if I miss a week here and there, I apologise for that, but don't worry, I've not stopped. I'm going to keep this going for as long as I can keep ideas coming. So my idea for this week is I thought I would give you a bit of a show and tell, give you a bit of information with it. And I thought today I would give you a nice little bag with my name on it and a little T-Rex that my girlfriend kindly designed for me. And in here I have all of the medications I take. So as you can see, this bag, there's a lot in here, as I'm currently on 10 medications and I'm on an injection as well. So I thought I would go through one by one each of the medications I take, and first of all tell you what I have them for and tell you the other reasons people might use this medication. So without further ado, let's get on with the video. Okay, so first of all I thought I would give you the most important one that I take, arguably, and that is the Adipo. So Adipo is a type of tacrolimus, and tacrolimus is known as immune suppressants. So immune suppressants are usually taken by transplant recipients, as myself with a kidney, and it's used to stop your body from rejecting that kidney or that organ, depending on what kind of transplant you've had. As some of you may not know, if you've had a transplanted organ, your body recognises that as a foreign object and will try and attack that because of your immune system. Will try and attack that organ and send it into rejection. So the Adipo that I take is to help stop my body from rejecting my kidney. Now, when I take my Adipo, I have to stick to a strict schedule of taking it 12 hourly, or at least as close to 12 hourly as possible, as this help keeps the levels of it in your system balanced, as if your levels go too high, it can almost poison the kidney and send it into rejection that way. And if your levels aren't high enough, then your body will start attacking the kidney. So it's important to keep a strict, consistent level with this. Now, every time I go for bloods, my doctors keep an eye on my tacrolimus level, which is for my Adipo, and make sure it stays within a certain range so it doesn't go too high or too low. And if it does, they'll just vary my dosage depending on which way it goes. Okay, secondly, we've got mycophenolate. Now, mycophenolate is also a different type of immune suppressant. So this also helps with the Adipo and stops my kidney from going into rejection. Mycophenolate, however, has also been known to treat certain skin conditions and sometimes arthritis also. Now, I take this twice daily, usually when I take the Adipo, as it's easier to remember then. And my dosage on this has stayed the same since transplant, so it doesn't have to be as monitored strictly as Adipo has to. So medication number 3, we have AlphaCarcinol. Now, AlphaCarcinol's main use is as a vitamin D medication, so it helps increase your vitamin D levels. It mainly focuses on improving your calcium levels, so it helps your calcium levels within your blood and your bones and helps keep your bones strong. AlphaCarcinol has been known to regulate your parathyroid hormone levels, but that doesn't affect me, so I don't really know much about that. But from my research, it has been known to help that in some people. Now, I take this medication just once daily in the morning, which is when I take the bulk of my medication. And the dosage of my AlphaCarcinol varies on my calcium levels. So if my calcium's a bit low, the dosage might increase and vice versa. So next up is medication number 4, and that is Amepazol. Now, the main use for Amepazol is to help control acid reflux and help regulate your stomach acidity levels. It has also been known to prevent stomach ulcers. In some circumstances, Amepazol has been known to treat a rare condition called Zollinger-Ellison syndrome. And that's, to sum it up, that's basically having a tumour within your pancreas. But like I said at the start of the video, I'm no expert or professional, so I don't know the reason behind this. Like I said, this was just in my research. I mainly use Amepazol to help balance my acid reflux and stomach acidity levels, as the amount of medication I'm on, this can be strongly varied. and I just take the 1 tablet in the morning of Amepazol. So next up we have dispersible aspirin, or just aspirin. Now most of you probably recognise the name aspirin, and that's because it can be used as a painkiller alongside paracetamol or ibuprofen. As my use for aspirin is that it's known to also be a blood thinner, so it's especially useful for me as it can prevent blood clots around my transplanted kidney area. As especially in the first few months of recovery after transplant, it is a high chance that I can develop blood clots around the area, so it was key that I was on this from the get-go. Now for people that use it as painkillers, it is mostly used for helping treat headaches. I also just take this once daily in the morning with every other med, and I've been on this since transplant. As I said before, it was key to keep the blood clots to a minimum, especially after transplant. So next up we have folic acid. Now folic acid is used to help produce healthy red blood cells in the body. It's usually used on patients that are anemic or have low anemia levels, which is a low red blood cell count. Now some people might recognise folic acid to be known to be taken by pregnant women, because it's known to help an unborn baby's brain, skull and spinal cord develop properly, to help minimise any chances of the baby having any developmental issues. Now folic acid, like most of my medication, I just take once daily in the morning. Next up we have amlodipine. Now amlodipine's main use is to be known as a blood pressure tablet. It is known to lower your blood pressure if you have a high blood pressure. It can also be used to help prevent future heart disease, heart attacks or strokes. It can also be known to ease chest pain, mainly caused by angina, which is usually chest pains caused by heart disease. Now surprise surprise, amlodipine I take once daily in the morning as well as everything else. So next up we have Doxazosin, the one that I seem to really struggle to say for whatever reason. Now Doxazosin is also a blood pressure tablet similar to amlodipine. However, it has also been known to treat symptoms of an enlarged prostate in men. Now with Doxazosin, I take it twice daily in the morning and the evening, as both that with the amlodipine help keep my blood pressure to a fairly stable level. Now we next have sodium bicarbonate. Now sodium bicarbonate, some of you might know, is helped to treat indigestion, and it can also relieve heartburn. Now sodium bicarbonate has also been known to help with kidney function, so that's my main use for it. It also can be known to help make your blood and urine less acidic. And I take sodium bicarbonate 3 times daily, so I take it in the morning, the afternoon and the evening. Now last but not least on my oral medications, I take Laperamide. Now Laperamide isn't really one that's known for kidney patients, but the reason I take it is it can help treat diarrhea, as throughout the concoction of all the medication I take, I do struggle with upset stomachs quite frequently. Laperamide is mainly used on IBS patients, which is irritable bowel syndrome, and also patients with Crohn's disease. It can also be taken by people that have a colostomy, which is, you may have seen it on the internet before, which is people who have a opening in their abdominal area, where their poo essentially is passed out of. And Laperamide's taken in these patients to help thicken it, so it doesn't make, so from what I'm guessing, it doesn't make as much of a mess in their colostomy bags. Now Laperamide I take twice daily in the mornings and the evenings, but I am hoping to wean myself off this soon, as this is a medication I voluntarily take. So last but not least is my RNS injections. Now first of all, I have to keep these refrigerated up until I use them. So that's kind of why I have my fridge over here, is to keep any medication that needs to be refrigerated in. So RNS is an injection which has helped to improve hemoglobin levels. So in simplified forms, hemoglobin is a protein within your red blood cells that carries iron and oxygen around your body. So as some of you probably remember before, because of my folic acid, I am fairly anemic, as my iron levels can get quite low sometimes. Also my oxygen levels within my red blood cell can be a bit low at times. if you're ever around me, you might sometimes see me breathing a bit heavier, and that's because of that exact reason. So I have my M&S injections once a week, usually on a Friday, as I don't know, there's no specific reason, but I just remember to take them on Fridays. And this is to help improve my hemoglobin levels, which will also help my iron and oxygen levels. But yeah, so as you guys can probably see to the side of me now, this is all the medication I take. I'm currently on 10 different medications and the 1 injection. Hopefully over time I can slowly be taking off some of these as my bloods start to stabilise a bit more. But this is what I take at the moment. Maybe down the line we can check and compare the medication I'm on in a couple of years' time to now and see how it's different. But thank you so much guys for tuning in today. Take care, and like I said at the start of the video, if I'm not uploading, it's because I'm brainstorming ideas. So I'll come back as soon as I can when I've got video ideas. Take care for now guys, and I'll see you when I see you. Goodbye.